Welcome back. One of the most talked about topics surrounding the vaccine is infertility in women. Now, this myth is causing a lot of women in their childbearing years to be hesitant about getting vaccinated. So Dr. Jonathan Dario joins us live now to talk about whether the vaccine is safe for women who want children in the future or are even currently pregnant. And Dr. Dario, thank you so much for being here with us tonight. And I will be very candid. This is a conversation I'm definitely having among my friends. I've had people ask me, people are reaching out to their OBGYNs. Does the COVID vaccine cause infertility?
Well, I mean, just like you said, at this time, any thought of infertility is a myth. Vaccines in the past and vaccines that we've done all throughout modern medicine haven't had any side effects of what we consider to be infertility. Just per regular guidelines within pregnancy, if you're due for vaccines, we still recommend that you have those vaccines so that you're safe, the safest you can be. The biggest promotion or idea of this is that as a mother, you actually transfer some of your antibodies to your child. So, and this is like a passive transfer. So your child will now have some protection when they're born if you have those antibodies circulating in your system. So as for the COVID-19 vaccines, be it Pfizer and Moderna, the American College of Obstetrics Gynecology actually has no contraindications for the COVID-19 vaccine. They do recommend it to be given in pregnancy. Although there haven't been trials for a vaccination, they know that the importance of the COVID-19 vaccine and that for the population of adults who are pregnant, they would qualify and they'd be candidates for the vaccine itself.
And I just want to be clear really quickly. You said that no vaccines known, and especially the COVID vaccine, are known to cause infertility. That's not something that's been proven.
Yeah, typically vaccines, the ones that we give out nowadays in modern medicine, there's really nothing that we've seen or indications that say, hey, this vaccine has a risk of infertility. If it did, then of course we'd have concerns. There are other medications, there are other vaccines, specifically some that are live viruses, things like that, where we're sometimes careful about giving around pregnancy. But that's always, those are separated and they have nothing necessarily to do with infertility itself. It's just the risks of you getting that vaccine. As for the COVID-19 vaccine, since it is, as Terry was telling us earlier, it's an mRNA vaccine. This isn't something that it has any live virus. There's no risk of actual infection from the vaccine itself. It's merely just something that your body creates similar protein to mimic, so to kind of trick yourself into figuring out what that virus is. So when you do get exposed to it, you have that protection. So in this case, it's something that theoretically should be even safer than some other vaccines that have been made in the past. That's why I think again, the ACOG, the American College of Obstetrics Gynecology, those that would be your gynecologist who would be recommending, should you get the vaccine? And in all purposes, usually they'd be saying, oh, there's no contraindication here. You should be pretty safe to have it.
And I want to switch gears here for 1 second.
I recommend that, you go to your gynecologist and you have that discussion. There's no harm in having that discussion with them. And I'm sure they're going to help you feel reassured if you should or shouldn't proceed with that vaccination.
And I want to switch gears here for 1 second because a new poll says that more than half of parents say that they will probably get their children a COVID-19 vaccine. And this is a topic that we're tackling next with you, Dr. Dario, because the Axis Ipsos poll found that 52% of moms and dads will get their kids vaccinated when a vaccine becomes available for their age group. And data also showed that Republicans are actually the most resistant to having their child vaccinated. And about half of those respondents said that they've at least gotten one dose of the vaccine. So if you are just joining us right now, Dr. Jonathan Dario is still with us right now, and he's talking about if it's safe to get your kids vaccinated. So with all that being said, is it safe for kids, and when could we see a vaccine being approved for children?
So right now, there's no approval for children. It's actually has to do with, and this has to do with the idea from when we look at pediatrics versus adults, so children's versus adults. We could come with an approach that, even though, kids, like we like to sometimes think children are smaller versions of adults. That's not absolutely true. When it comes to medications, when it comes to vaccines, because we love our kids. So we're just much more strict on what we do for them. So the trials that they initially did, of course, were in adults. I know they expanded some of the range for vaccinations to include 16 to 18-year-olds for if they meet those requirements of like the high-risk groups. But as we go along, they're starting some trials with, I believe Moderna already started a trial. I believe Pfizer is too, to expand into those lower age groups. More than likely, they're going to kind of start slowly, where they're going to do maybe the teenage years first. I think Moderna is actually doing a younger version starting off already. But it's just something of a process that you want to take much slower, just because it's our kids. We can't just and we can't really adjust the dose just by, oh, hey, this child is half the weight of an adult. We give it less than that half weight dose.
And so these trials may take longer for the kids. It may take longer to get these trials because, like you said, you can't just cut half of the dose. It does need to be a full dose.
Exactly. So it's going to be very, very much tailored for your child itself. And that's why it's going to be taking longer. And
once we get more information, do you think doctors are going to recommend to get their children vaccinated?
Oh, I definitely believe they will. As soon as the CDC and the trials go online and FDA can approve them for the use, then I'm sure physicians will recommend them to have it vaccinated.
All right. Thank you, Dr. Dario. Still ahead on 23 BC News at 7. You may have decided to get the vaccine, but how long does it last, and will we need booster shots? Well, we'll break all this down for you when we return.